In this presentation, I will be discussing neuromuscular electrical stimulation and its application in speech and language therapy. Neuromuscular electrical stimulation is a device that sends electrical impulses to nerves. This input causes muscles to contract. These devices can be used to restore or replace motor function. This can be an effective component of a rehabilitation program for muscle weakness. Electrical impulses cause muscles to contract through electrodes placed on the skin. These devices typically consist of a stimulation controller unit that is connected to multiple electrodes which are positioned near targeted muscles or nerves. Manual controls set stimulation waveform pulse parameters such as frequency, amplitude, and duration. Neuromuscular electrical stimulation can be a part of the treatment plan in many conditions such as post-stroke, spinal cord injuries, multiple sclerosis, cerebral palsy, Parkinson's disease, and those recovering post-surgery. So how is this relevant to speech and language therapy? Firstly, it can have a beneficial role in dysphagia, a term which refers to difficulty in swallowing. This device enhances the strength of the muscles associated with swallowing and facilitates reflex swallowing by sensory stimulation. Various studies have shown that this treatment can improve oropharyngeal swallowing in stroke patients with dysphagia. Recent studies have shown that neuromuscular electrical stimulation can be an effective component of augmentative and alternative communication. AAC is a set of tools and strategies that an individual uses to solve everyday communicative challenges. Dysarthria is a motor speech disorder in which muscles that are used to produce speech are damaged, paralyzed, or weakened. Baronati et al. 2021 investigated the efficacy of neuromuscular electrical stimulation in the treatment of severe dysarthria. This 2021 case study investigated an 18-year-old patient with dysarthria and cognitive impairment resulting from a severe brain injury. Conventional speech therapy was ineffective due to the patient's inability to understand instructions. The patient was then treated with Vital Stim, which is a neuromuscular electrical stimulation therapy system. The patient underwent 2 daily treatment sessions of 30 minutes, 6 days a week for 4 consecutive weeks. 2 adhesive electrodes were applied to the facial muscles on both sides of the face. This treatment achieved reduction in dysarthria severity for the patient, showing potential in improving dysarthria in patients who are unable to carry out conventional speech therapy. It is thought that neuromuscular electrical stimulation could allow for improved articulation and vocal parameters, thus enhancing communication skills for people with dysarthria. New instrumental approaches to assist conventional dysarthria treatment are needed, and neuromuscular electrical stimulation could represent a valid approach. More research is required in this area. Thank you for listening.
Created using Powtoon.